You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome everybody to Dr. Osborne's Zone. Today we've got a special guest interview with Dr. Milton Bastidas, and I brought him on because he's one of the best experts that I know in enzymes. And this is a big category or topic that a lot of you have asked about, is what are enzymes? When should I take them? What kind should I take? What are the differences between them? So Dr. Bastidas, thanks so much for being here. I'm really eager to pick your brain on enzymes. So
thank you very much for having me.
So let's talk about what got you in, because your background in chiropractic.
Yes, sir.
Most people wouldn't think chiropractor is an expert in enzymes, but what got you into this field?
Well, it kind of dropped from heaven. I always say it's a blessing, to have this come to my table. I was regular chiropractor, seeing personal injury, seeing, pain and sports-related injuries, just, doing my thing, adjusting. And with the years, you notice that, people get better with chiropractic, but there was a certain percentage that, kept coming in and weren't getting any better. So, noticing in their medical history, you notice, all kinds of medications they're taking, their lifestyle, and it kind of cued me into, there's something more than just, musculoskeletal. There has to be something related to the gut. And also correlating it to a personal experience at home, my wife, she would have a lot of health challenges. We never really got to the core, the root of the problem, but we would take her everywhere. She saw gastroenterologists, internists, endocrinologists, and no one can ever get to the root of her problems. She would have achy joints, bloating, brain fog, everything that's more related to functional medicine than just a condition, a disease, or something that you want to label. I went to a seminar one day, and the seminar was called Drugs That Don't Work and Natural Therapies That Do. And it was a nutrition seminar, and to tell you the truth, I just went because I needed to complete my 16 hours of continuing education, to activate my license. And it was a nutrition seminar. It was the only thing I could take. I only had 3 or 4 more days, to have to take it. And I went, and it was a well-recognized doctor, Dr. Brownstein, and I even took work to the seminar because I said, nutrition, it has nothing to do with what I do every day. And Doc, I ended up being glued to the speaker, and every symptom that he named off was my wife. I said, oh my goodness, he's talking about my wife. Make a long story short, that's what started my functional medicine journey. I started taking a lot of functional medicine seminars, started getting a little bit of knowledge into the holistic health and how nutrition is so tied into overall well-being, and how your gut is where everything starts. Fast forward, I had one of the reps from Transformation visit me, and we started talking, and they were looking for someone to partner with them to do a clinical study on one of their formulations. And I accepted the invite, and I performed a little study on inflammation. And forward 10 years later, here I am, talking to you. That's how it went.
That's how it goes with a lot of doctors. They have a personal experience.
A personal experience,
and
correct.
Where medicine failed them, and now they're looking for other alternatives and
Yes.
other options.
Yes, completely our story.
So your wife today, is she doing well?
She's doing very well. She's doing very well. She still has hiccups here and there because she's very sensitive to, gluten to soy to casein. There's a lot of things that impact her, and we really can't live in a bubble. So anytime we go out to eat or we go to a reunion and we don't have control over what it is she's eating, she gets flare-ups. But at least we know what her health challenges are and what's the root of everything that she was suffering for so many years without us even knowing.
So and that's confidently relieving, right? Because now instead of just wondering, you know if it does get too terribly bad, you know how to control it.
Very much
right?
so, yes.
Diet,
yes,
right?
Yes.
So let's talk about enzymes. The two classes of enzymes I think that I'd really like you to go into to start would be, there's digestive enzymes,
yes, sir.
right? And then there's proteolytic enzymes that people
Correct.
oftentimes use for pain and inflammation.
Yes.
Can we just start with just a general overview of the different types of digestive enzymes and formulas and why a person might want to use them, or what would be the indications for their use, and then go into proteolytic after that?
Great. Yes. So as a matter, before I start this, let me just tell you, if I were stuck in an island and I only had one supplement I could choose, it would definitely be enzymes. Enzymes are energy-rich proteins that we can obtain from our food, we can obtain from our pancreas, and they are a catalyst to convert, let's say, a piece of food, meat, into its constituent amino acids, so that then those constituent amino acids are able to be absorbed and carried to every cell of our body, so our cells can use them in order to make more tissue, to repair, to create your hair, your nails, your skin, et cetera, et cetera. So those are the guys that are responsible for breaking down our food and allowing us to absorb all the nutrients, whether it's vitamins, minerals, your lipids, carbohydrates, essential fatty acids, amino acids, et cetera, et cetera. And again, the digestive enzymes, primarily, we make digestive enzymes from our pancreas, but we can also obtain digestive enzymes from the foods we eat, because the foods are their own little biome, their own little ecosystem that also have enzymes in order to help them mature. And for example, when you see a banana start going brown, those are the enzymes that the banana has that starts breaking down the starch. So we can obtain them from either foods or from our own. The importance is that over time, with aging, I think after about your late 20s, early 30s, your digestive enzyme building capacity starts to go down. And I think everybody will be able to notice that when they were in their teens, they could eat a whole cow and they could digest it very easily. Now in our age, we eat, something small, and it takes us longer to digest it. So supplementing with digestive enzyme is just aiding your digestive capacity, because one of the things with digestive enzymes is your body takes a lot of energy to produce them. So when you take digestive enzymes supplementally, you're aiding your body and allowing the pancreas to not work so hard at digesting or producing the digestive enzymes for all that food you just ate. So that's where digestive enzymes come to play.
So I want to back up to one of the things that you said, which was as we hit our 30s, our capacity for production starts to diminish. Is there a reason? There's some thoughts for me come to mind. 3 decades of eating processed garbage and probably self-abuse doing damage to the potential to the pancreas and to the GI tract.
Most definitely.
Or is it truly an age-related issue, or is it a time plus damage related issue, or can you elaborate any on that?
So it is, it is an age-related issue, but more so, it's compounded with the damaging lifestyle that we've led, and I think the lifestyle has more to do with it than your natural aging. With your natural aging, you're only losing about, after your 30s, you're only losing after, every 10 years, you're only losing about 10% of your digestive production. Okay, but you compound it with, you know, smoking, alcohol, you know, the gluten, the sugar, the stress. You know, stress is a big killer of your digestive process. So yes, you compound all that on top of natural aging, and I think the lifestyle has more effect than actually your natural aging.
So hope in that, right? Because a person could make different choices, right?
Yes, definitely.
And have better preservation of their own production.
Yes.
Okay. If one of the questions I get asked a lot is, if I take digestive enzyme supplements, will that shut down my body's ability to make its own digestive enzymes?
That's a very interesting question, and I get that a lot as well. There is no negative feedback loop from you supplementing digestive enzymes to the pancreas. So if you supplement digestive enzymes, your pancreas is not going to notice and say, hey, there's too many digestive enzymes, I'm not going to produce anymore. Just like there is with other substances, you know, for example, hormones. If your body detects a lot of hormones in your circulation, then your own producing organs that produce those hormones will kind of slow down the production. Not so with your pancreas. Your pancreas is stimulated to make its enzymes by several aspects. Number one, you look at a piece of food and you get hungry. That right there starts your pancreatic juices flowing. So, visual, okay? The center of the area of the brain that brings to memory, oh, I love that steak. I can't wait to get into that steak. You know, you're hungry, and you go to your favorite steak restaurant, and you're already thinking of, I'm going to tear up that steak. That's already sending messages to your pancreas to produce. Okay. Another thing is food. When there are receptors that sense the pressure of incoming food, that pressure sends a signal. It turns on cholecystokinin. Cholecystokinin turns on the pancreas to make its pancreatic enzymes. So there's several aspects of your pancreas turning on to produce enzymes. Your pancreas stops producing the enzymes whenever it doesn't have those signals, your brain, your visual, your taste, the weight of the food no longer present, then your pancreas stops producing the enzymes because it knows that it's done its job. So that happens independently of if you're supplementing enzymes or not. So no, there is no negative feedback.
Well, it makes sense. You mentioned before, food has enzymes, so technically many supplements are derived from food-based enzyme sources, so it would make sense that if you're eating food, that also would not shut your pancreas down, correct?
Exactly,
Yeah.
exactly. And the enzymes that are in food are mostly for the enzymatic processes of that food.
So they're specific and unique to helping you break the food
Yes,
down.
and that's one very important aspect of enzymes. You know, people seem to place enzymes in a very, very general, broad category. You know, enzymes are very specific. You know, each enzyme has its own specific substrate. The substrate is what it hydrolyzes, what it works on to break it down. So just because you're taking enzymes doesn't mean that you're gonna, you know, shut off different mechanisms. I've even had people ask me, you know, if you have an ulcer and you take, you know, the proteolytic enzymes, is it gonna eat away at the ulcer and make the ulcer bigger? No, because the enzymes that you're taking has a specific substrate that it works on. It doesn't work on live tissue. So yes, there's a lot of misunderstandings and misconceptions about enzymes in general.
Let's talk about different kinds of digestive enzymes. You know, protease, lipase, amylase, different
Right.
ones have different purposes. Is this?
Yes.
So let's talk about those, because I know people looking at a supplement, right? They go to the store, you know, maybe they got some reflux and they heard, you know, digestive enzymes might be helpful, or maybe, you know, maybe they have a history of gluten-induced damage to their pancreas, and so
Right.
their pancreas is underperforming. Like, how do they navigate that label to understand what those words mean? Which enzymes do which digestion?
Okay, so you have carbohydrases, which, you know, pretty much take care of carbohydrates. You have lipases, which take care of lipids, and you have proteases, which take care of proteins. And those are the three general categories. Within the carbohydrates, then you have the polysaccharidases, and you have the amylases. You have different type of carbohydrates enzymes that work on, for example, some work on starch, others work on, cellulose, other works on different aspects of fruits, different proteins in the fruits and the vegetables. So, but in general, if you're taking an enzyme supplement that has carbohydrates, lipases, and proteases, it's going to pretty much help you digest everything that's on that plate. So it's very good to look for a formula that is very broad spectrum, so that way you can pretty much have digestive activity on everything that you're eating. If you only take a lipase with a meal, well, you're only going to digest, or it's going to only help you digest the fat in the meal. If you only take a protease, it's only going to help you digest the proteins in the meal. So if you want to tackle everything that's on your plate, then make sure it's a broad spectrum enzyme blend, enzyme formula.
So if you're following a carnivore diet, a good protease would be all you would need. But if you're eating a kind of a mixture, carb, fat, protein, then
Yes.
good broad spectrum is where it's at.
Most definitely, most definitely. And I also get asked, well, how many do I take? Everybody's different. And it also depends on the food, the portion of the food, Personally, this is not a license for people to go do this, but when I go to like Texas de Brazil, or I go, to a place that just brings you meat, every so often, I take a lot of proteases because I know I'm going to put down a lot of meat. So how many do you take? Everybody's different, and it depends also on the portion. Find that number. I tell my patients, you find that number. If with one digestive enzyme, you feel that after you eat, you're light, you're not, full for 2 or 3 hours, then that's your number. If one doesn't do the trick, then take 2. If that doesn't do the trick, take 3, 4, 5. Find your magic number, and do not worry, because enzymes, there's no toxicity risk with enzymes. They don't accumulate in your system. Your body recognizes them. They do what they need to do. When they're done, your body either recycles them or gets rid of them. So there's no overdosing with enzymes. It's beautiful. There's no overdosing with them, and it's not like a drug, or not even a vitamin or a mineral that you dose depending on grams per kilogram body weight. Enzymes are not like that. So you can take as many as you want, as long as it's doing the job. And you're not going to shut down your own pancreas. You're not going to overdose on an enzyme.
Okay. So is there a benefit, let's say, to a person who has no gallbladder, maybe they had it surgically removed? Of course, bile being the aspect, bile not being an enzyme, but is there a benefit for somebody to use lipase who's lacking a gallbladder?
Most definitely, most definitely. As you know, patients that no longer have their gallbladder, they don't have that organ that houses what the liver is sending over, and there's no ejection once there's fats coming into the lumen. So now the only thing they're dependent upon is that duct that still is available, that used to go to the gallbladder, that's no longer there. So you still have a little bit of that function going, but you're not going to have everything that you had in terms of digesting fat when your gallbladder was there. So taking lipase is a very good idea.
Let's talk about gluten enzymes. PPD4 being probably one of the most popularized proteolytic enzymes to help with the breakdown or the cleavage of gluten. One of the big questions, I'd just like to hear your opinion, is some people will say, well, I'm going to take my gluten breaking enzyme and then I'm going to go eat at Subway, or I'm going to go have pizza. Right, they take it as a crutch basically to try to help protect them. Is that a good idea?
That is not a good idea. I mean, it's if you're really highly intolerant, or if you're celiac, it's really not a license to kill. It's not a license to go and eat all the gluten you want. When you take your enzymes, the capsule has to dissolve. The food that you're eating may wrap around the content of the capsule. The enzyme may be stuck in the bolus. So all the enzymes might not get to all the gluten you just ingested. And if you're highly intolerant, then that gluten is going to knock you out. So it's not a license to go out and just splurge on gluten when you know you can't tolerate it and when you know it's done some damage in your gastrointestinal lining. So I recommend the DPP4 enzyme just as a precaution or to mitigate in case you go out and you have no control over what you're eating, or you're at a party and they serve you something that you don't know what went into preparing that food. That's when I say go ahead and take your DPP4. But I definitely don't say take your DPP4 and go eat all the pizza you want. No, I don't give that recommendation.
So more as a protection against cross-contamination or accidental exposure?
Yes, most definitely. Yes.
Okay. Let's talk a little bit about proteolytic enzymes as a tool for pain, inflammation, healing and repair. There's a number of different formulations out there that have been studied and researched, but I'd like to get your take. You mentioned earlier that you were doing research with Transformation. I would imagine in a musculoskeletal setting, outcomes being, pain, probably.
Yes.
Talk to us more about that.
So most definitely, I love proteolytic enzymes. I fell in love with them when I started researching them. I thought enzymes were just for digestion, because that's pretty much what we learn in school. Enzymes are for digestion, but enzymes go way, way beyond just digestion. They have that systemic component, and proteolytic enzymes such as bromelain, papain, actinidin, which comes from kiwi fruit, the papain from papaya, bromelain from pineapple. Also mycelial enzymes that come, from Aspergillus species. These are actually able to go through the gastrointestinal lining into the circulation, and once they're in the circulation, it has a ton of therapeutic benefit. One of them being anti-inflammatory, anticoagulative, increases blood rheology, so it has a detoxifying effect. It cleans out the gunk in the circulation. And that is huge because anytime you clean up the circulation, anytime you get that blood flowing, what's going to happen? You're going to have more nutrients, more water, more oxygen being fed to every single cell. So blood rheology is a big one. And the inflammation is also a big one. And the beautiful thing about this, like I said earlier, is there's no toxicity, there's no overdosing in it. Your body uses what it needs, and the rest it'll either get rid of it or recycle it. So when you take proteolytic enzymes on an empty stomach, of course, because you want it to impart its benefit systemically, unless you want it to impart its benefit with digestion, you take it with a meal, it's going to digest the meal, the proteins in the meal. But if you take it on an empty stomach, it's going to make its way into the circulation, and your immune system actually recognizes it, and it gets transported throughout the whole circulation, head to toe, and helps in detoxifying, helps in cleaning up the blood, helps with inflammation, helps with antigen antibody complexes that are stuck within the joints, and just by it helping with inflammation alone, that's huge because, as you know, Doc, everything that walks through your door has one common denominator, and that's inflammation. Whether you call it cancer, whether you call it rheumatoid arthritis, whether you call it hypertension, call it what you want to call it, they all have one common denominator, and that's inflammation. So if you have a natural substance that you won't overdose with, that there is no toxicity with, that's going to help you with that one common denominator for any condition that you want to name, that's beautiful. And that's where my love for these enzymes started growing and growing. The more I learn about them and the more I see the true benefit in clinical practice, the more I fall in love with them. So yes.
So what was your research looking at? Was it looking at specific types of situations or conditions?
So what we did first at Transformation, when I was asked to come along, Baylor College, Baylor University had conducted on one of Transformation's proteolytic enzyme formula, which is a TPP protease. They had conducted a placebo-controlled double-blind study on that formula and pro-inflammatory cytokines such as interleukin-6, interleukin-1 beta, TNF-alpha, the COX-2 enzyme. As you know, these are all players in the inflammatory cascade. And they found that these proteolytic enzymes reduced those pro-inflammatory cytokines that travel in our body in times of inflammation. So what I did was I did a follow-up to that, and I said, well, not all doctors measure cytokines, right? We measure, cytokines are usually measured, at hospital settings or research institutions. A doctor really doesn't measure cytokines. So how can we relate this message on a clinical level? So what we do measure is, things like sed rate, C-reactive protein, fibrinogen, which are also, acute phase reactants. They're also elevated in times of inflammation. So what I did was I set up 4 groups. We did a control group. We gave them, a sugar pill. We did a mild dose group, a moderate dose group, and then a high dose group. So those 4 groups we tested. We measured baseline, CRP, fibrinogen, sed rate, homocysteine. At baseline, then we measured it again 6 weeks, then we measured it one final time on 12 weeks. We told them not to change any diet or lifestyle, no lifestyle modifications. What I wanted to see was how adding proteolytic enzymes to their life without modifying anything, what was going to be the outcome of these 4 clinical inflammatory markers. And what we found out, Doc, was, we already knew that from Baylor, these proteolytic enzymes reduce those pro-inflammatory cytokines. So I had a pretty good idea that we were also going to get the same effect with these clinical markers. And sure enough, we got the exact same thing. CRP, fibrinogen, sed rate, they all went down. And that's pretty much what I did with the inflammation study. Then we kind of took a look at a leaky gut. I performed another study for leaky gut, and in that we measured symptoms, patient symptoms. We did stool tests. We did a food sensitivity panel. We measured antibodies to zonulin, occludin, atomyosin, which are tight junction proteins. And we did lactulose mannitol for leaky gut. And we took a number of participants, and in that study, I did modify their diet. I cleaned up their diet. No gluten, no soy, no dairy. Everything had to be organic, natural. It was a paleo-like type of food, recommended food list, and we dosed them with digestive enzymes, proteolytic enzymes, and probiotics. And across the board, we had major improvement in their stool, major improvement in antibodies against their gastrointestinal lining, major improvement in leaky gut, and major improvement in symptomatology. So those are the 2 big observational studies that I've performed at Transformation: inflammation and leaky gut.
With what you were saying earlier about the enzymes creating an anti-inflammatory effect, but you mentioned markers like fibrinogen reducing. And that is blood thinning. I want to be clear, not necessarily blood thinning as much as maybe blood normalizing, right? Because
you got it.
Thinning would be, the artificial manipulation of clotting proteins that would lead to the inability for a person to properly clot. Enzymes don't do that.
That's very important. I'm glad you mentioned that, because that's one of the other things we get bombarded with. Am I going to thin my blood if I take too many? No. The beautiful thing about enzymes is they're not adaptogens, but they're adaptogenic-like. They're adaptogen-like, meaning that it doesn't go overboard. In the example you gave, It doesn't thin out that blood. It normalizes it. It modulates the immune system to where it quenches inflammation. It doesn't turn off the immune system like steroids do. So that's beautiful, because what you're going to do is you're going to balance things out. You know, whether it's blood clotting, you're not going to completely thin out the blood. You're just going to bring that coagulation to a normal and stable level. Same thing with inflammation. It'll either increase the immune response when the immune response is low, or it will decrease the immune response when the immune response is too elevated. So it kind of balances things out, and it knows when to quit. It knows when not to go overboard.
So it's almost like an intelligent molecule.
It's a very intelligent molecule.
Like some of the other, like we could use examples of adrenal adaptogens where they don't necessarily raise or lower cortisol per se.
Exactly the same thing. And like I said, even though they are not adaptogens, because adaptogens have to follow certain criteria, they're not adaptogens, but they have adaptogen-like capabilities.
So let's take a patient who, for example, has, maybe they're on Coumadin, or some other, fill in the blank, the blood thinner, right? Is taking a digestive enzyme, a proteolytic enzyme, on an empty stomach to get that anti-inflammatory systemic benefit a contraindication in that individual? Do they need to be aware, or do they need to be warned that their blood might get too thin because the effect the enzyme has combined with the medicine leads to an even greater response?
To be on the side of safety, we only recommend people to take it away. Not because we fear or we know it's going to potentiate and thin out the blood too much if they take it with your blood thinner, your prescription drug blood thinner, but it's because we don't want a patient taking it with a blood thinner and then have an episode of overbleeding and blame the enzyme.
Gotcha.
It's not the enzyme's fault, because the enzymes don't thin blood. They just clean the circulation. They improve the velocity of the blood, and not by thinning the blood, but by cleaning all the toxicity that lies whenever there's a lot of inflammation. So what we do is just, for the patient's, mental, for them to relax, we just recommended to take apart from their prescription blood thinners.
I know you guys work with a lot of doctors all over the world. Do you ever get stories from different doctors? I know you work with a lot of medical doctors who also use drugs, so like have kind of an integrative type practice. But do you ever work with cardiologists who use digestive enzymes instead of blood thinning medications in order to improve the blood viscosity in their patients?
At Transformation, there's a good number of medical doctors. I haven't heard of specific practices only using digestive enzymes instead of what their discipline entails. But I do know that all of them that are part of Transformation's family of doctors use enzymes in conjunction with their discipline. And that's another beautiful thing about enzymes. You can, no matter the discipline you're in, no matter the choice of treatment that you provide, you could be a hormone specialist or a cardiologist or an internist or a gastroenterologist. Whatever it is you're doing, you could add enzymes to it. And I've never seen anything where there's been a contraindication or a doctor calling in and saying, if you have a patient on this drug, make sure they're not taking enzymes, because it's never happened.
So take-home message is there's really no contraindication as far as any literature has ever reported. Your doctors don't report them. So taking enzymes is safe. I think
very safe.
We could say that.
It has a very good track record.
But if somebody's on a blood thinner, you just tell them to take them apart from each other because you don't want the enzyme to be blamed.
Exactly.
Okay, gotcha.
It's more so to keep the enzyme from getting the to be villainized.
Yeah. Well, I mean, you see so many people with blood thinners who, they've got pulled blood underneath their skin because they are being basically over-medicated, because the doctors that are prescribing those drugs have, the one thing they have in mind is, we want your blood so thin that you don't stroke or you don't have a heart attack, because you maybe have, maybe you do have arterial or atherosclerosis, or maybe you have blockage somewhere. But there's a cost that they're paying by over thinning their blood, synthetically.
Right.
But there wouldn't be a cost. Again, that's what I'm trying to get at. There's not really a cost, a risk benefit, if you will. It's all benefit, no risk when it comes to using digestive enzymes.
Yes, most definitely. You got it.
Okay. So what are some other things that you guys see enzyme helping with? Because we've talked about digestion, we've talked about lowering inflammatory markers clinically, and I think, let me just back up on that too, because I like what you did. You wanted to make it applicable for clinical practitioners to say, okay, how could I validate this? Because you're right, nobody's doing TNF-alpha measurements on their patients in clinical practice. So CRP,
fibrinogen,
erythrocyte sedimentation rate are tests that people can, if they have. So if you're listening to this and your levels are high, and you wanted to use a digestive or proteolytic rather enzyme and do your own experiment, you could do that on yourself without hurting yourself, without it being contraindicated, and then have your levels of those simple tests that you can ask your doctor to run: CRP, ESR, and fibrinogen. And if it improves your numbers, you have a winner, and it's working for you. Even if no symptomatic change happens, there's a chemical change that we know is leading to a reduction in inflammation. So there's a benefit there, because we don't always feel inflammation, right? Right.
We don't always feel it. But you know what? In the participants that I've had in my observational studies, symptoms have always improved.
So
even people that didn't know they had a symptom.
So their norm was the symptom, and then they realized that's not normal?
Exactly.
Yeah, because we get that. Exactly. Yeah, we get that a lot. And people, they're like, I've had diarrhea my whole life. I always thought that was the standard of what happens to people, right? I've had the skin rash has been there all the time, so I never knew what it was like to not have it. So,
exactly.
So symptoms that they didn't really perceive to be abnormal, they also were reporting changes on.
Most definitely.
Okay, so reduction in inflammation, improvement in digestion. Let's talk about some of the other clinical indications that you have seen and that maybe some of your other doctors have also seen, with their patients.
If you go into the literature, there's even support for cancer.
Well, I know Nick Gonzalez, the late Nick Gonzalez, was very big into pancreatic enzymes.
Most definitely.
At high doses for patients with, terminal poor prognosis,
most
pancreatic
definitely.
cancer.
And if you look at that literature, he had tons of success with that.
The best success that anyone's ever had. I mean, he still has today. He's dead, but he passed. But he still has people that had 2-year prognosis that are still alive from the treatment he was giving before he passed.
And why is that? Well, the reason is, cancer, it follows a certain, there's hallmark of cancer, and it follows certain criteria, and it has its own environment. It loves sugar, it loves an anaerobic condition, it loves, acidity, and it loves inflammation. Well, with proteolytic enzymes, we know there's an anti-inflammatory effect. Anytime you reduce inflammation, anytime and you increase circulation, the circulation is going to bring in oxygen. Okay, so right there we've got inflammation, we've got oxygen going in, we've got inflammation going down, oxygen going in. We also have nutrients coming in. Okay, with the diet we cut off the sugar. Okay, we also it alkalizes the blood to a certain extent. So now you're taking the lifeline of the tumor away. And also enzymes have a selective ability to hydrolyze and break apart a receptor called CD44. That receptor encodes for metastasis. So if you're taking away a receptor that encodes for metastasis, what are you doing? You're keeping that tumor from spreading. And that's in the literature. That's not, anything I say, it's not me saying it. It's things that I've...
Which researchers have already discovered these are properties of enzyme therapies.
Exactly. So it's anti-tumorigenic. It helps with cancer. Just from the aspect, just by you knowing that it helps with inflammation, which is the common denominator in everything that walks through our door, including cancer, that right there is going to tackle a whole bunch of anything. Name it what you want to name it.
Heart disease, diabetes, Alzheimer's, any type of arthritis, any type of autoimmune.
That's all inflammation. At the cellular level, you have a hyper-inflammatory state creating a condition that is expressing itself in symptoms. And that's the way I look at healthcare, at wellness. I don't tag it with a name, because when you tag it with a name, then you only look at what has been said about that name. But when you take the name off and you say, oh, this is a hyper-inflammatory condition that is affecting my XYZ organ and it's expressing in these A, B, C, D symptoms, you go to the root cause, which is, a hyper-inflammatory state from, it could be, drugs, alcohol, smoking, stress, a pathogen, gluten, food intolerance. But you go to the core, you get rid of course, the trigger, you quench all that inflammation, you modulate the immune system so that it can work for you, not against you. Then that condition with that label, with that name, starts being unmasked. And you take control of it.
Yeah, I like the way you said that. It's almost like giving a disease the name almost creates an entity of victimization for the person, because they're, when you get cancer is a perfect example.
Yes.
If you ever talk to anybody who's ever gotten a cancer diagnosis, they're instantly paralyzed and instantly in horrific fear of their life. And as you know, we don't make great decisions when we're in fear.
Oh yes,
right. So it changes the decision-making matrix of the person out of fear. But so the diagnosis as a name really victimizes the patient, but it also prejudices the doctor toward a therapy that might be pharmacologically approved by the FDA without technically trying to understand what those actual triggers for that disease that we decided to name are. Right. So if you go backwards, root cause, functional.
Right. And then you get lost. Patient gets lost, fear sets in, and then, just the fear alone may become bigger than the disease.
Right. I've seen that happen. Yeah.
And we've experienced it in the last 2 or 3 years with this big thing going around. The fear was worse than the actual thing that's going around. So that's where people get stuck, in that fear, and then they start making irrational decisions with their health and with people around them.
And they're fight or flight, which shuts down digestion, which shuts down enzymatic production,
there
and
you
back
go.
to where we're at, right?
And it all starts in the gut. It all affects the gut is the biggest endocrine organ that we have. It's what they call our second brain. It's got more afferent fibers than the actual brain. As a matter of fact, I think that your gut is more important than your brain. Because there's so many things going on there, and it's the interface between your outside environment and your internal, environment, and it's what dictates what comes in or what has to remain out. If you have a dysfunctional gut, then things come in that aren't supposed to come in, and that elicits an immune response, and that immune response creates inflammation. And where does inflammation travel? From head to toe, and that's where imbalance, that's where disease sets in. And as you know, Doc, you never have a patient that walks in your door and says, Doc, I've been suffering with this thing that I'm suffering with for a couple of days. No, it's always, I've been having this for years, decades, or since I was a little kid, or since my adolescence, or after I had my first child, or it's always like decades into feeling bad that they come in. Of course, when they started feeling bad, They went the allopathic route, and all what they were given was what? Chemicals after chemicals after chemicals to create more of a dysfunction. So, you know, they get lost in that, you know, searching for the answer with things that aren't giving the solution.
Yeah, Band-Aid.
A Band-Aid, correct.
Yeah. So we've covered a lot. We've covered digestion. We've covered blood, let's say blood quality. We'll put it at that. You brought up cancer, and then, of course, the big one, which is the underlying driver of most chronic degenerative disease, if not all, is just systemic inflammation caused by triggers, usually self-inflicted, even in ignorance, right? Not necessarily stupidity, although sometimes we all do stupid things, but a lot of people eat the wrong things out of ignorance or do the wrong things out of ignorance, and there's a lot of everything we're saying today would be completely conflicted by two other doctors sitting on a different couch, right? Talking about, you know, you should be treating, you know, that with chemo, or you should be treating that with, you know, statins or whatever, you know, fill in the blank, right? Whatever the case would be. So there's all that dichotomy and information is floating around out there. But I think the crux of this conversation is a person can use a digestive enzyme to benefit their bodies in multiple ways and to support their bodies in multiple ways, you know, to include enhanced or improved digestion or reduction in gas, bloating, or intestinal discomforts. And it won't hurt them. And they can take, you know, as much as they need to take, and there's not really a major contraindication for higher doses.
Right.
I mean, always listen to your body, but, you know, if you take 8 and you don't feel well, obviously your body's communicating to you something. But as a general of thumb, there's not like any major research that shows there's a toxicity level of enzymes.
No, most definitely.
And if you want to take them as a preventative or as a blood cleaning supportive tool, is something that you can do as well. It's, again, not going to hurt you. The potential for help is very strong. The
Most
science
definitely.
behind that is very strong.
Yes.
Are there any other things that you feel like our listeners might benefit from understanding about enzymes beyond those?
You know, that's pretty much it. I mean, I find it to be, that's the first thing I give my patients when they come see me is enzymes. You know, I give them an enzyme with every meal because, you know, we are eating even things that we don't know we're eating. You look at a label and there's things you can't even pronounce in there, and there's things that aren't even on the label that aren't placed on there for some reason. So you don't even know what you're eating when you go out or you buy something. So I just tell my patients, take a digestive enzyme with every meal and find that number that works for you. Could be 2, could be 3. Okay, don't worry about overdosing or toxicity. Take a proteolytic enzyme on an empty stomach so you can get that systemic benefit. And then I offer them probiotics as well, just to support the immune system and have overall good gut health. But even beyond that, Doc, I educate them on eating real food. Because these enzymes, they're not magic pills either. I'm not going to sit there and lie to you that, do whatever you want, just take your enzyme. No. The foundation and the genesis of good health is what you're putting in your mouth. And I think you know more than I do on that subject.
I'm glad you bring that up, because I think, a lot of people, we live in an allopathic mindset world, right? See symptom, treat symptom, even naturally, right? I call it green medicine,
yes,
right?
Yes.
So many people could be, let's just say coerced or easily nudged into believing that they could continue a bad behavior, right? Or basically justify the bad behavior with the supplement. And I like hearing you say that, taking this is not so that you can do your body harm in other ways. Taking this is an enhancement to helping you live a better life and be supportive of an already healthy body where you're making great and healthy decisions.
Yes.
And not as a crutch, to justify your bad choice.
Right. And I always tell my patients, health is not linear. It's not take this for this symptom, take this pill for this symptom. Your body doesn't work that way. Even statins don't work that way. You take a statin for cholesterol, but you're not just lowering cholesterol. What else are you doing? You're shooting down a whole bunch of other things that metabolic enzyme that makes the cholesterol also does. So either in the green medicine doesn't work that way either. You know, take this vitamin for this symptom. It doesn't work that way. You know, your body has its resources that it uses from. It has a pool of resources, and that pool of resource comes from what you eat. So you provide your body the tools, and your body decides what to do with those with those tools. Okay, I need to make more skin, so it takes amino acids and uses it for that. I need cofactors for making this skin, so it takes the vitamin A, the B complex, the iron. It takes, you know, the cofactors to help that enzyme making what the tissue it needs to make. So your body ultimately decides what it's going to do with what you give it. You just got to make sure you're giving the body what the body recognizes as food, and you're not giving the body harmful chemicals. You know, I also tell my patients, you know, food is not to fill your belly. Food actually has information, and depending on the information you pick, is going to dictate how your body responds. Because you could take an orange with its good fiber and good you know, vitamin C, you feed that to your cells, and that information, that good information, crosstalks with your DNA to turn on those good genes. On the other hand, you take, you know, processed food with bad information, a bunch of chemicals, and you eat that bad information turns on bad genes. So, you know, food is information, and depending on what type of information you're giving your body is going to dictate how your body responds. And it can respond in wellness, or it can respond in disease. So food is always the foundation for everything. And then the enzymes just go over and beyond and help you extract those good vitamins and minerals and amino acids and you know, all the nutrients that your body, your cells need in order to repair and thrive.
Fantastic. Well, thank you very much. I appreciate you coming on and sharing your enzymatic expertise
Thank you very much
with
for
us,
having me.
and thanks for the work you do and shedding the light to so many sick people and helping them find better health.
Well, thank you very much. I appreciate it. Thank you for watching.
Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.